go into this, don't yell at me, don't throw napkins at me. If I'm walking down the aisle, don't stick your foot out and trip me. Because I'm not trying to convince you that an orthodontist down the street or a GP that does Invisalign is not your competition. But I want you to think about it differently. Really think about this. And then we're going to give you a quick tip you can implement right away. It's going to make a difference. Competition is 4 main things. Any high-level CEO and entrepreneur, Steve Jobs of the world, know that their number 1 competition is themselves. Have that up as number 2 up there, is themselves. We all have tendencies. We're all people. My tendency is I let paperwork build up in my home office a lot. It drives my wife nuts. I try to correct it. It's just a tendency of mine. I have other tendencies as well that I don't even want to tell you about, but the paperwork is one of the big ones. You guys all know what your bad side is. Correcting that and finding ways to accomplish and improve yourself all the time. Not just asking another doctor. Find people that own successful businesses regardless of the profession and learn from them. Better yourself all the time. Something that I've spent years doing. I love learning from other people that have had successful companies. Because no matter what business it is, you can apply it back to, in this case, an orthodontic practice. You guys have employees. Again, you have to motivate them. You're selling something to a consumer. They can choose you or somebody else or nobody at all. So finding companies that are successful with creating the right culture, training their staff, doing things differently than what other people in whatever industry they're in, finding those people to help you out. And there's other things as well. We all know ourselves can be sometimes the biggest competition we have. The first one is any business offering something to consumers that they value, that they understand value, and therefore are willing to spend their disposable income. Best Buy, family vacations, vehicles, wheels for their vehicles. Thousands of examples. Jewelry, thousands of examples. That is your main competition because consumers value that stuff. We all know in here that orthodontics is not just for cosmetic purposes. In fact, in more studies that come out, it's for medical purposes. The cosmetic, it just happens to be there to make you look pretty. That's all fine and good, but it protects you from a lot of bad things that can happen. But consumers don't view it that way. They still look at whether it be Invisalign or some other type of method. They view it as cosmetic to look pretty. And the reason for that is a lot of things that go on that we're going to talk about inside the practice environment every single day. But those are the people who is your true competition. Because if I walk into any one of your practices today, you present me with a $5,000 Invisalign case, and I just left Best Buy 2 days ago going, man, that 72-inch screen, that was 4. I can get that, put off orthodontic treatment, and it happens all the time. All the time. The other one, by a raise of hands, who would say GP Invisalign practices is a big competitor of yours? Who would think they're okay? Anybody else? GPs who do Invisalign. Competition. Normally the hands go up like crazy. Just a couple. What about GPs that don't do Invisalign? Which one would you view more as competition? Ones who do it or ones who don't do it? Do it. So you're not going to agree with me tonight, but I want to plant a seed in your head. That the GPs, and this doesn't mean you're not still going to get referrals from the ones who don't do it, so don't get me wrong. But the GPs doing Invisalign are your friend. They're your friend. But you have to look at it that way. Because, okay, they may be doing cases that are maybe smaller or easier, but if you create the relationship with them, guess who's going to get all the harder cases? And we've been in hundreds of GP practices that don't do Invisalign as well. They don't even have the conversation with the patient to begin with because they don't make any money on it. So they're not even talking about it. Does that mean you're never going to get referrals from them? Of course not. You probably all in the room get referrals from GPs if you're not doing Invisalign. But looking at it differently as an innovator, because most orthodontists, at least ones that we've worked with, can't stand the GPs who do Invisalign. Some of them have a hatred towards them that I can't even comprehend. Some of it's really, really, really bad. But if you look at it as an innovator and do it differently than how everyone else looks at it, and you partner with that practice and say, we want to be the practice that you give all your hard cases to. and you're on their mind all the time, at least that hygienist, maybe not effectively, but at least that hygienist is having the conversation daily with patients. Again, if they don't do Invisalign, that conversation is not happening. Not happening. We had a patient that, I'm going to go to this first. Everyone agree that's a good Invisalign case? Anybody that would say no? Good Invisalign case, right? You guys know more than me.
Yes.
That'd be hilarious if everyone said no. No, we don't know what you're talking about. So everyone would agree, yeah? This GP, who doesn't do Invisalign, told this person they're not a candidate for it. And that happens all the time, all over the country, and it's another representation of lost opportunities, both for your individual practices, whether you have 1 or 500, but also aligned as a company. Across the nation, this isn't the only conversation that's happened. This wasn't a one-off. This happens consistently. And again, with a practice that does not do Invisalign. Lost opportunities.